What if somebody gets better on a gluten-free diet and they don't have the autoimmune illness? Why are they improving?
These are the patients that we call them non-celiac gluten sensitive.
Non-celiac gluten sensitivity. So they're sensitive to it.
Yes.
So why do they get better?
We don't really understand why they get better. We have a lot of theories on this. There is a small subset of these patients that are really allergic to wheat. And it's not the gluten, it's something else in the wheat. Then there are also some patients who are allergic to some other carbohydrates that also in the grain, but it's not in a gluten. And we think that might produce some allergic reaction in these people.
Can we, are we able to establish that diagnosis? Are we getting closer to making, we've got laboratory evaluation for celiac disease. Are we getting closer to having something that says, yes, you've got gluten sensitivity, intolerance, allergy to gluten? Do we have a test for it?
Unfortunately not. So these are the patients who have all the symptoms of celiac disease, but they don't have celiac disease on testing. They don't have antibodies on the blood work. They don't have changes on the biopsies. We check their genetics. They're not predisposed, but they have all the symptoms, and then you take the gluten off their diet, they feel perfect. You put it back in a diet, they have symptoms. That's how we make a diagnosis.
So what do you tell that patient?
We tell these patients, that's what you
Stay
have.
away from gluten.
Stay away from gluten. And these patients, they might develop tolerance over time. So sometimes we tell them, yeah, try to go back on the gluten and try to see if that would help you out or not.
What happens if they go on a gluten-free diet, they get better, and they try a half a piece of bread and they seem to tolerate that, but if they eat bread for 3 days, they don't tolerate it? Is there a quantitative evaluation on that where they eat too much gluten, or they just do better staying away from it?
If they prefer to stay away from gluten, that's fine. If they decide they want to try some gluten and they do well on some gluten, that is also okay. Patients have to understand that gluten-free diet has some complications. Gluten-free diet put them at the risk of some deficiencies of some micronutrients, of vitamins, even minerals. Even patients, when they go on a gluten-free diet, there's some studies to say they have maybe higher risk of having heart disease, even a lung disease sometimes. They understand that risk, it's okay.
So they need guidance knowing the risks and the benefits. And the benefits is I feel better. They're on a gluten-free diet. So can you add nutrients to that? You say, I want you to stay on your gluten-free diet. You can cheat if you want a little bit. Now, this is not the celiac disease. Sure. We don't cheat at all. But do you give them, is there a certain kind of gluten-free vitamins to take care of those nutrients?
When I see these patients in the office, I check a whole panel of micronutrients. We check vitamins, minerals, we check liver enzyme, we check a lot of things. And if they become deficient, we supply them with
that should be very interesting to follow those patients. Do you intermittently go and look for those celiac enzymes, again, those blood tests for celiac disease? Or do you say you just keep making sure those nutrients are getting digested?
It's unnecessary to check on these patients with the blood work or biopsies, because they're typically not going to show it positive because they're avoiding the gluten, which might have caused problems. They really have celiac disease.
Do you find that these patients get better and better?
Sure. These patients can get even better if they start to take some other items out of their diet, like what we talked about before, FODMAPs,